My name is Mark Rotich, and I'm the Deputy Regional Director, Sub-Saharan Africa, supporting the programs in the region. We have had the COVID-19 pandemic affecting our learning in the region. The first thing to mention about the effect is that the schools were closed. In Kenya, we know that the school opening will now happen in January. So this means in the Kenya context, learners will be away from school for more than 9 months. And this means that the time that the learners will be at home would be quite extended. In Rwanda, the schools will be opening in September. And also when it does open, in both cases, it's going to be a repeat of the academic year. So this period that is a lockdown, it means that it's considered as no schooling year. The biggest impact is that we are seeing the loss of learning that is happening in our learners. This is because there is no continuity of learning in many of those countries that are affected. Secondly, that the teachers are not engaging largely with the learners because there have been no clear policies and support, and also because it was expected that this was a short-term effect. So it is very clear now that the pandemic is going to last for a very long time, and therefore we need to ensure that during this time some continuity of learning is happening. There are also other things that have come up, issues to do with safeguarding that we know is having a challenge in especially girls, some having issues to do with safeguarding, like things like early marriages, pregnancies. Those are the issues that are coming up quite strongly in terms of extended stay at home. In view of this, that the learners will be at home for a very extended period of time, the Education Development Trust in the programs they run in the region have had some approaches to support learning continuity. First of all, we did a research to understand what are the learning needs. This was done in all the countries that we operate in because we want to base our approaches on evidence. So that was the first thing that we did to understand what are the learning needs. Secondly, in our approach, we want to make sure that the teacher is at the center of all our approaches so that the teacher is engaged. We know from evidence that teachers play a very critical role in the learning of our students. So that's one approach that we are using. The third approach that we are using is to ensure that we have a mix of methods. This includes high-tech, low-tech approaches that we are using, and also includes low technology. The high-low-tech technology approaches is because we have areas that have various types of technology, internet, and this can be used to support learning. But there are also areas that have no technology, they have no access to technology, and therefore we're using the non-technology approaches. Finally, we are also using a systemic approach. This is to work with the stakeholders, largely with the government, to ensure that we are supporting them for remote learning and also supporting them in preparation for return to school. Specifically for the Kenya context, our program is aiming and reaching about 70,000 girls in the areas that we operate in. The first thing we did was also to understand the needs, and we used the most recent assessments that were done before the schools were closed to design targeted learning tutorials for our learners. Secondly, we began to use the various methods that I mentioned earlier on. So for those who are in urban areas and have high penetration of technology, we are using the smartphones, we are using the online platforms to be able to reach them. So we are using WhatsApp to reach out to our learners, and we are also using SMS platforms and also using the online to reach our learners. In areas that we do not have the high penetration, we are using low tech and no tech. So we are using our community health volunteers to deliver materials to learners, and we ensure that these materials reach learners and learners are able to interact with the materials and send it back to the teacher. The final approach that we're using in the Kenya context is to support the teachers directly. We're using the community of practice, so they are using their various platforms, SMS, WhatsApp platforms to be able to engage. In Rwanda, they follow a similar approach. First of all, they did an assessment. They assess the penetration of the smartphones and also the radio. They are running a radio program. This radio program is broadcasted through the national system and also through the local FMs. And this is supported by continuous teacher professional development, so that the teachers are also engaged in terms of engaging with learners and also engaging with themselves through the community of practice. So this approach allows the learners to get also feedback, because in Rwanda the radio lessons are interactive, so the materials are prepared in advance, and when the learners interact with materials, if they have any challenges, they feed back to the teachers. The teachers on their own are having their community of practice, and the head teachers are also involved and supporting the teachers to be able to interact with the learners. In Kenya, we are using community health volunteers. This is a structure that is within the Ministry of Health that allows us to reach households. In the Rwanda context, they are using the teachers. They are not using the community health volunteers. The lesson we are learning is that there's an opportunity for learning to happen remotely and also at household level. And this means that there are other stakeholders that needs to be involved in learning, and this is the parents and the guardians. So this remote learning requires that the parents or guardians play a very important role. And this includes giving the learners the opportunity to learn, or the space to learn, and also supporting them in terms of tutorials. So when the schools open, we know one of the major challenges will be re-enrolling back our learners. So we would want to work very closely with the national governments to have a very strong back-to-school campaign, to make sure that we are able to enroll as much as possible of our learners to be back in school. In the meantime, one of our key challenges is tracking. We are tracking all our learners to know where they are and what they are doing, so that we can be able to give them life skills. We upskill them in terms of knowing how to remain safe during the COVID-19 period, and also to continue engaging in learning. Thank you.